Well, Professor Karim Khan, welcome to the University of Salford podcast. Thank you for agreeing to be the very first podcast on our new module.
Happy to, really happy, Dale.
Okay. So the new module, Progressions in Exercise Therapy, begins really with us trying to understand the importance of exercise. But before we talk about that, you came to visit Salford University recently, and we got a chance to show you our facilities. What did you think?
It was great to be in Manchester, such a famous city, and in Salford, and I was impressed by the enthusiasm of the students. They were getting ready for exams at the time, but enthusiastic to have a chat about sports medicine. And then I really liked the facilities. You've got a big set of facilities, really. I'm not sure that I've seen a set like that with a range of content and equipment and labs and nice teaching spaces and great clinics. So when you can combine the clinics with the teaching spaces, that's a great advantage for the students.
Yeah, very much so. No, we're very lucky to have it, and thanks for that nice compliment. Before we progress forward with the interview, would you be okay just telling the students a little bit about yourself and your background and why you're such an authority on exercise?
I'm not sure about the last part, Dale, but I was fortunate enough to have had some great mentorship in sports medicine from some Australian colleagues such as Peter Buchner and Peter Harcourt, who worked with elite teams, and also physiotherapists have been great mentors for me: Jenny McConnell, Jill Cook, Kay Crosley, names that will be familiar to folks. So I was in a time and environment where Australia was leading up to the Sydney Olympics. We had a decade of opportunity for sports medicine people to train and to benefit from working with teams and to do formal study. And I came from the medical training, obviously, but the physiotherapists have been great mentors, as I said. So then I guess just brief stories, I did some research. I was interested in clinical problem, initially navicular stress fractures in the foot, and I realized that the textbooks don't have all the answers, and so it's good to try and solve some of these problems. And so a group of us collected a series of patients with navicular stress fractures, and we looked to see what treatment was best, and the best treatment turned out to be not weight-bearing and using crutches and things. But that sort of led me to the taste for research as well. And so since in the 2000s, I sort of combined research and work in the clinic. And then in 2008, I had the fortune of being the editor, being able to become the new editor of the British Journal of Sports Medicine. And so then I've given that quite a bit of time in the last 8 years, and I've limited my time in the clinic. And we have been really trying to get the messages out to folks about the benefits of physiotherapy, the benefits of sports medicine, and I guess I'm exposed to a lot of work that way, and so it's a privilege to try to share that with audiences such as your students on the podcast and in person.
Wonderful, and it's certainly nice to hear that you're a champion for physiotherapy. So physiotherapists are really interested in movement. So if we start the questions with, is movement medicine?
Cool. Obviously it is. So my challenge is how can we convince people of that? And one of the examples that I have used before is that if you think of it as someone who dislocates their shoulder, then the humeral head is obviously sitting on the scapula. And in the days before we had treatment of this with modern methods, 200 years ago, people had to sort of live with their shoulder dislocated, and the fascinating thing was that the actual scapula formed a joint, a curved space with articular cartilage. Not perfect articular cartilage, obviously, but it really developed into a form of a joint, and the people were able to function for another 50 years after the shoulder dislocation. So the lesson there is that, in this case, bone has the capacity to turn into another structure, in this case cartilage. And so that's unusual. Most people don't realize that, and that's one level of when physiotherapists are prescribing exercise and getting tissues to repair, that's one stimulus. And the other one is obviously the cardiovascular, brain health, depression, all the body systems type of exercise to improve our health. But I think it's good for physios to be aware that they've got the capacity to influence both the injury side and the health side.
Yeah, as part of that sort of biopsychosocial holistic approach. Is movement evidence-based practice?
I think you can argue that if we're talking about exercise for health, and on the slide there's 30 minutes per day of moderate exercise, that provides more health benefits than any medication we know. And when I say more benefit, I mean because it crosses the systems. And so we've got cardiovascular health, we've got blood lipids health, we've got brain function, both depression and also cognitive function. We've got enjoyment of life, so quality of life. Obviously, all the systems, gastrointestinal tract works better, the kidneys work better. You know, every system works better with this dose of the miracle cure, the poly pill, really. And that is evidence-based. There's powerful evidence for that in each of the different systems. And the one I'll really summarise with is from Stephen Blair. And he measured people who were 50 years of age in his study, and he evaluated them on a fitness on a treadmill as well. So they got a measure of fitness, an objective measure of fitness, not to maximum but sub-max. And then he checked their risk factors like obesity and hypertension and diabetes and smoking, for example. And then he followed to see what happened to those people for the next 20 years. And what happened is 18% of them who died, and of that 18% who died, they were the ones who were in the bottom 20% for fitness. So that meant on the treadmill they weren't able to do what we would be able to do if we walked for half an hour a day. But that was 18% who died. Now the obesity group, only 2% of them died, and in diabetes, for example, and smoking, about 6 or 8% died. And so really, if you add up smoking, diabetes and obesity deaths, they almost got up to the level of the low fitness deaths. The take-home message is you're better off being a smoker or being obese or being diabetic than being in that bottom 20% for fitness, and you can stay out of the bottom 20% of fitness by walking for 20 to 30 minutes a day.
Wow, that's significant, isn't it? And the great thing for myself as a physiotherapist is when the Academy of Medical Royal Colleges, i.e. the doctors, are saying, hey, exercise is the poly pill, as you put it, that's an exciting time, isn't it?
It is an exciting time for physiotherapy, absolutely.
Yeah. Okay, so we're going to move on. Now we know that medicine is an important part. What about the quality of movement? Do we need to make sure we're moving well before we move often? The risk of poor biomechanics or risk of injury, or is that outweighed by just getting on and moving?
I think let's talk about different groups of people. So if we're talking about regular people in the community who aren't playing sport and they might enjoy walking in nature and being physically active for tasks like shopping or walking between lectures, which you obviously have to do, but say commuting. We call commuting a walk interrupted because you have to walk to the bus or train and then walk from the bus or train. I think in that situation we just need to encourage people to be active. So this is the difference in physical activity and exercise and sport, as you say. So physical activity is just embracing being active, and I think the quality of that obviously is not important. But then once we get into exercise, maybe recreational specific walks and jogging for fun, then biomechanics can be a factor. And then in sport, obviously, good biomechanics is going to both reduce the risk of injury and improve your chance of performance. As again, the physiotherapist is in a good position to work across that spectrum and encourage regular people who might be into physio for back pain, say, and to ask the question about being, are you physio active, and encourage them, maybe give them a story of how important physio activity is, and just be a counsellor. So that's the role of physio as a counsellor. And then if people are exercising a reasonable amount, the physiotherapist can have the role as a clinician and try and improve the quality of movement, as you say. And then, as the more the elite athlete becomes and the more critical the physio's understanding of subtle biomechanics comes in, and I'm sure you teach that both visually with the naked eye and then with video analysis and other methods to be even more sophisticated.
Yeah, that's right. But I like the fact that the physiotherapist needs to be a counsellor of physical activity and exercise. And that's something we probably do, but we don't recognise it as a counselling role. So I like that analogy. We're moving on to vital signs. We were discussing before the podcast started some stuff that you had there. But healthcare professionals generally monitor 4 vital signs, and that's body temperature, pulse rate, respiratory rate, and blood pressure. And now in the sports medicine community, we're potentially looking at exercise as the 5th vital sign. Could you go on to expand upon that for us?
Yeah, it's a pleasure to, Dale, and I'd almost make the argument that it's the most important vital sign in the modern world, because if we think of the history of those vital signs, things like temperature and blood pressure, that's related to infections and the communicable diseases, really. And those vital signs came from the 1800s and 1900s, obviously. Yeah. But now that non-communicable diseases are the biggest health burden, you can make an argument that the best measure of risk of non-communicable diseases is physical inactivity, as I shared with you just before. And I'd remind the listener that we've talked about 30 minutes of walking, but the first 10 minutes is the most valuable, and the next 10 minutes is valuable again, and then the next 10 minutes adds a little less value. So we've got to try and encourage people to go from being sedentary to even doing 10 minutes, because even if people only do half the guidelines, they get about a 10 to 20% reduction in death rates just without even meeting the guidelines.
Wow.
So this speaks to the importance of the physical activity sign, saying to people, as a clinician, as a physiotherapist with a patient, every patient saying, sure, we've treated what you've come in here for, leg pain, shoulder pain, back pain, but let's just tell me about your physical activity. Do you think you accumulate 30 minutes a day or 60 minutes a day of physical activity? Do you walk in your daily activity? What do you think? And obviously now with the technology being so readily available, many people have it on their phone. They might wear pedometers. And so just engaging that conversation in a regular clinical appointment, I think, is a challenge. And given that in real life everyone's busy for time, and in private practice it's tricky. And I think the challenge for practices is to decide how can we do this routinely. Maybe the receptionist can give people a form to fill out where it's the 2 questions are how many minutes do you exercise for when you exercise, and the other question is how many times a week do you exercise, and obviously the 2 of those will give you a number which ideally will add up to greater than 150. But we need to emphasise physical activity as well as exercise. So I think it's a great opportunity for physios, and it's probably the single most important thing they can do for a patient, even if the patient comes in for something else. And I'll finish that one by saying another good analogy is to tell a patient that it's as important as giving up smoking for smokers, and most people get a sense that that's a big deal for health.
Yeah, I like that analogy about the smoking analogy. Sitting is the new smoking. The campaigns are telling us, and that's a good analogy. So with regard to the student physios, asking about a patient's exercise habits is a must in every subjective assessment. Would you agree with that?
Yeah, and I'd just like to underscore the difference between physical activity and exercise again. So physical activity might be incidental, and the person might not think about it if they walk from their work to a place to get lunch and walk back. And if people are playing with kids, for example, so there are a lot of adults who can build physical activity into their day, and they can take the stairs instead of the lift. That's what I do in my day here. So let's really make sure the patient's aware that that is great as well, rather than patient thinking, well, I don't have time to go to the gym, I don't have Lycra, I don't have a bike, so I can't exercise, so there's no point. We need to encourage those people and liberate them to being able to get 30 minutes by having a walking meeting is another good example that we've talked about before, Dale. So there are ways of snacking, what we call snacking on physical activity, and then exercise is a different level and sport is a different level. But from a public health point of view, we need to get people to understand that even physical activity is crucial, and it is easy for most people to get. I mean, in our Western world, it's a bit silly to think that people can't exercise for 22 minutes, which is the daily dose if we multiply it by 7 to get 150 per week.
Yeah, I'm in complete agreement with you, and I like the analogy of snacking on physical activity rather than, oh, I haven't got time to go for a run, but hey, you've probably got time to walk up the stairs rather than take the lift, and that's a great way of thinking, that snacking on physical activity. I like that. I'm going to use that, Karim. Thank you. So now on to the profession specifics of physiotherapy. Are physiotherapists still regarded as experts when it comes to exercise prescription?
Well, in Canada, there's an advertising campaign, and physiotherapists describe themselves as the body experts, and I like it. And I think every profession has challenges in marketing its benefits to regular people who haven't been at universities and don't know what each profession does. And I think physiotherapists are body experts, and they're trained to be in the body for the whole of the course, whereas a doctor will get a small period on the body as such, and then a lot on endocrinology and drugs and things. So physiotherapists can readily claim to be the best trained on exercise prescription and the ability to prescribe physical activity for people with all sorts of conditions like osteoarthritis or back pain or all these limitations. I think it doesn't have to be an exclusive claim. I think the demand for physical activity prescription is so great that everyone needs to work together. So any health profession should work within their scope of practice and encourage physical activity. So we don't have to make it a gold medal competition and saying who's the best. But personally, I'm really comfortable to say that I'd expect physios to be, the best as a group. If you compare a random group of 100 doctors and a random group of 100 sports physios particularly, then the sports physios will be way better and should be way better. And so that's great. So I think physios should be very comfortable and liberated in themselves, going, look, this is our mission. One of our missions in life is to be the physical activity promoters and to help the specifics and help people who think they've got limitations like osteoarthritis, like I said, or back pain or nerve pain. There's barriers to physical activity, wheelchairs, all those things. Physios obviously can help with that. And I see on the slide you've got some different contexts where physios can do this.
Yeah. So yeah, I'm in complete agreement with you. The message we've got to get out, the exercise and physical activity message we've got to do through health promotion is huge. And that doesn't have to be exclusive to physiotherapy. In fact, it shouldn't. It's too big a message. It's just that physiotherapists should be right up there when it comes to exercise, because we're in the UK hospitals performing rehabilitation classes, group classes such as falls and cardiac rehab. We're out in the community, and of course we work in sport. But as you said before, there's so many people out there. As long as they're appropriately qualified, we're all delivering the same message, aren't we?
Yeah, and obviously at Salford, for example, there's the BASRAT group, the Association of Sports Rehabilitators and Trainers, for example, and I know they get terrific training and I think join some of the same classes as physios. So that's an obvious example of someone who's well trained in exercise prescription. Yeah,
exactly. Working alongside each other. So we're going to move now to the clinician's role within exercise medicine. And I know we use an example, a Canadian example of the 7 Investments program. But where do you see the clinician, as in, it could be a doctor, could be a physiotherapist, could be someone in sports rehab. Where do you see them in the spectrum of medicine? Could they be at any point? Do we need to be going into the schools? Do we need to be going into the transport areas and encouraging more people to walk to work or cycle to work? We're obviously in primary care. Do we need to be more in education? Do we need to be more community-based? I think sport is pretty saturated. Where would you like to see physiotherapists and clinicians within exercise medicine? Where are we lacking effectively?
Sure. I think this is a great slide, and the structure that you just listed for folks who don't maybe have the benefit of the slides if they're walking or something. There's this concept of the 7 investments to promote physical activity, and these are domains that in an ideal society will be supportive for physical activity, and it reflects what's called a socio-ecological model. So it sounds like jargon, but really if the listener thinks about smoking, for example, how did smoking get cut down? It didn't get cut down by individual clinicians telling individuals stop smoking, and that was it. There was legislation that you couldn't smoke in certain places. There was advertising changes about the packets, and there was education in the schools, and then after all, peers, encouraging people. So there's a range of ways of changing something at the society level. That's why it's called a socio-ecological model. So the ecology speaks to the fact that it's at different levels, like government, local communities, schools, families, down to the individual. So if you think of it like that, if we're trying to get the whole country more physically active, then if the listener didn't have any more of this podcast, they just figure out for themselves, they go, well, it makes sense that we need to have this in the schools. And so I think most physiotherapists aren't working in schools, but they're parents, for example. So I think then you can try and advocate and say, how's physical activity being promoted in the school? And then in the school, we need to make that important distinction between PE and activity in the school. And in studies where they've measured the amount of physical education, physical activity in PE, in physical education, if that's what it's still called, sometimes it's 7 minutes in an hour because there's a lot of talking about the exercises or teaching how to do a technique or something, and it's not actually very active activity during that hour, so you can't count that as 1 hour. But if the school has a good playground and good equipment, and it maybe provides equipment, then that would be great. But on the other hand, there's legal issues where I know schools have taken some playground equipment out because they're worried about people getting injured. So the point for us as members of the community and parent advocates is like, well, what are we doing in the school to make it an encouraging place for physical activity, and not necessarily working as an individual clinician. And then the same thing applies where there's transport and there's actually the built environment. So if you've got a massive freeway outside your place and there's no way to walk, then that's going to be a barrier. Whereas if you're in a mixed community where it's a walkable area and then there's associated transport, then that's going to promote physical activity. So our role as clinicians is to advocate for that sort of use of urban planning, and to advocate for transport rather than cars. So advocate for public transport, buses and trains and light rail rather than cars, and then encourage our patients to use those when we're talking to them about, have you thought about using the bus? How big a deal would it be to drive to a train station and then get the train the rest of the way? Then on that list of 7 investments, there's community recreation, so having community centres and having community activities, fun walks, charity walks, those sort of things, obviously a great way of engaging at the community level. And then the sort of big picture things are education, mass media, having campaigns, but those campaigns have to be supported by practical things that people can do rather than just having a campaign. So these things need to work together. And then sport, obviously, not just the elite level of people watch on television like the Premier League and the top women's events like volleyball and netball, for example, in our countries. But sport for all, so encouraging people to just be active, maybe recreationally, playing football in seniors competitions and things. So sport for all rather than just elite sport. And then that brings us back to primary care. And again, using the word primary healthcare broadly and inclusively for all the different professions, clearly all of us need to be advocating for that. But in this structure of 7 investments, the clinic's only one of the 7. And I think if you're wearing a public health hat saying, if you were the Prime Minister of the UK, how do you get it done? Well, it's not just about investing in the clinicians. So I think it puts the clinicians in perspective and saying, look, we've got a role to play and it's important, but for it to really work, we need to be one cog in a wheel.
Yeah, no, some great points there, highlighting the entire spectrum, and you know, completely agree with everything you've said. But that we need to be, physiotherapists need to be in all these areas, and we need to be getting the health promotion message out there every chance we get. Moving on to the next subject, which is rather a little bit indulgent, with regards to the London 2012 Olympics. And we know that physical inactivity is the fourth leading cause of non-communicable diseases worldwide, but in UK in particular, we haven't seen the dramatic increase in physical activity that we'd hoped for after the Olympics. In fact, it's unlikely to have changed in the last 10 years. What are your thoughts on that, Karim?
Yeah, it's a well-known fact that when they have studied the effect of these major events, if we call them mass events and major events, they don't promote individual level physical activity. So then we could ask ourselves, is that a surprise? And you know, I guess it's not really, because if we think about it as an individual, we love to watch those events, but we don't think about them a few weeks later. You know, no one's thinking about those events, and we just move on with our busy lives. So I think if we say that it's a good marketing strategy to try to get the Olympics in your city, and you say it'll be good for public health, it helps to get countries behind the Olympics. And the Olympics got a lot to offer, obviously, but the data don't support the fact that these mass events improve public health. So then the politicians and all the people involved at those 7 levels we just talked about need to say, okay, we're going to celebrate the Olympics for the certain reasons, and if we want to have them, then we're going to invest in them. And that's great, but it's not a public health. We can't say abdicate our responsibility for public health by saying, well, you've got the Olympics, so we're going to be okay. So I think it comes back to the 7 investments that we just talked about, that politicians, you know, promoting public transit ahead of changing roads to make cars easier to use, for example. Yeah, I think that's the reality.
Yeah. So back to the 7 investments program. And that's something for all physios to get involved with at all points during that. So moving on to something that's quite topical at the moment, you know, exercise versus nutrition, or exercise and nutrition. So with increasing levels of obesity and diabetes, should physiotherapists be giving not just exercise advice, but should we be also giving nutritional advice? What are your thoughts on that?
Definitely, yes. You know, physiotherapists are well-trained health professionals, and it's certainly in their mandate to give give advice within the scope of their practice and what they're comfortable with. So I think, as a health professional, you have a license to advise people about nutrition, sure, but you have a responsibility to know what you're talking about, as you would in any area. And if you want to specialise in some areas, then you know, that's the way to go. So I think physiotherapists can be open-minded as well, because I'm going to share a couple of things here that maybe some people find controversial, but to be honest, I'm surprised why. And my point is that for fitness, we've just talked for health, physical activity is the most important thing. We've just talked about that. So people on this podcast can be clear that I'm a big believer, and I said that physical activity is the single best thing you can do for your health. So that's straightforward. Now, the second thing, and what I'm surprised that some people find hard to understand, is if you want to have a healthy weight, and or your ideal weight, if you want to adjust your weight, if you want to wear, you know, a pair of pants that you used to wear that you can't wear now, you need to adjust your eating.
Yep.
And that seems unbelievable that a 5-year-old, you know, that seems so obvious that a 5-year-old could tell you that. A 10-year-old, it just seems like saying that the sun gets up in the morning and sets in the evening. It's like, if you want to control your weight, you need to control your diet. Now, but when we've discussed these issues, there's amazing emotion gets involved, and the one typical argument is people jump and say, you're anti-physical activity, you're not giving physical activity a chance, you know, but this is bad for physical activity. And it's absolutely not. It's not. They're two different things. Physical activity makes you healthy, and eating the right things will have you at the right weight. And obviously, adding some physical activity to your eating plan will be helpful, but the single most important thing you can do, and there are studies of this, where if you just test exercise or just test eating and you try to lose weight, then the eating is going to make the difference. So people just have to accept that. And so then you might say, well, why isn't that so obvious? And why is there emotion? And I think there are definitely the food industry has got it. If I was running a company that sold obesogenic products, then my strategy would be to confuse people, and my strategy would be to try and get people to think that exercise is the answer, because then I could say, buy as much of my stuff and eat as much of my stuff as you like, it's no problem, because you just need to exercise appropriately and you'll be fine, and it's just about a balance. That's what I'd say. And I'm not saying that any companies do that, because lawyers would be keen for me not to say that, so I'm not saying that. But I'm saying if I was the boss of a company that sold obesogenic products, and they're the ones, people know what they are, they're the ones that have a lot of sugars and things, then I would try and confuse people, and whenever this debate came up, I'd try and shut down scientific papers, and I'd try and shut down people who are speaking by threatening them with legal action and things like that. I'd try and get that message away that people have to eat healthily to have a healthy weight. And I try and confuse people so that that's helpful for me, because then once people are confused, then they'll just eat, things that aren't appropriate. So confusion is in the favour of me as an obesogenic company CEO. So, yeah, I think the other big fact that comes out of that people forget, a simple point to sort of close off, I don't want to go on too long on this, Dale, but is people forget about insulin. And it gets a bit hard for simple like energy balance, which is what the obesogenic companies want to confuse people with. But insulin is pretty straightforward. If you have sugars and you have then your insulin goes up, and what insulin does is it stores fat. So if I have a meal with a lot of cereal, for example, bread, grain, those foods, and sugars obviously, pasta, rice, then my insulin's going to go up a lot more than if I have a food that has fat and protein, and that's a fact. And then what that insulin does is it stores fat. So it says, great, I'm getting a meal that I can store as fat, that's going to help me later. And it's a survival thing. Whereas if I'm eating a meal with fats and proteins, then my insulin doesn't go up as high, so I'm not storing fats as much. And so in our Western diet, we've probably overemphasized the carbohydrates. And the food guidelines did that for a while, and Zoe Harcombe has shown convincingly that the guidelines weren't evidence-based. So this idea of 60 to 70% of nutrition from carbohydrates probably is not healthy. And I'm not saying anyone should have an extreme diet, but I'm saying that people should ask themselves, if they're trying to lose weight, are you eating foods that are stimulating a lot of insulin? Because what insulin's doing is it's storing fat. So if you want to store fat, then that's great. Fire up your insulin. And the best way to do that is have foods like pasta, rice, potatoes, grain products, cereals and sugar products. Then you'll be storing fat beautifully, and that'll stand you in good stead if you can't eat for months. But what it'll do is make you hungry in a couple of hours, because your insulin will drop back down, and then the body is trying to burn carbohydrates, and so it'll tell you, look, I've got to eat again. And so you get in a cycle. Whereas if you sort of switch your metabolism around so that your insulin isn't spiking, your insulin's staying fairly low with many fats and proteins, then you'll be burning fats, and then we all carry enough fats to last us for days. And so you can easily go from breakfast till dinner even without necessarily feeling hungry, in contrast to when I used to have breakfast cereal and muffins and things and toast, then I'd feel hungry by 11 after breakfast. So these are facts, and they're not popular facts. I think some people just emotionally find it hard to give up the sugar, so they're trying to justify and rationalise that it's okay. And the companies are trying to promote this because there's an obvious interest for people who are making obesogenic products to confuse people and to confuse the message. But physios are not trained. They're not trained by people who are funded by industry, and so that they can read this sort of thing. They can read things like Nina Teichholz's book, The Big Fat Surprise, for example, Gary Tover's book, Why Do We Get Fat, and look at this with an objective mind and then give advice. So, long answer, but physiotherapists, we're all health professionals. we need to have the patient-centered approach. We need to work within our scope of practice, and we need to be open-minded to new evidence. And I think on the latter point, some professions haven't been open-minded to new evidence, and some professions are funded very heavily by the obesogenic food companies, and they're reluctant to evaluate the evidence in an unbiased way.
Yeah, that was such an important topic. I'm glad you explained it as well as you did. So from that, we can say that, you know, obesity and diabetes, they're on the increase. Physiotherapists have a social responsibility, not only to talk about exercise, but to talk about the patient's nutritional status. And, you know, if someone is suffering from overnutrition, then we need to address that if we're providing a patient-centered approach. So that, you know, that's good to hear, because, you know, we do understand the body, we do work on evidence-based practice, and it's important that we get the truth out there to the individual and dispel any of these myths. So moving on, so physiotherapy, exercise, and the future. What are the real hot topics that you think physios should be champions for in the future, Karim?
I'm happy to do that, but if I just take 30 seconds to give you one reason why I think that sort of downplaying the role of exercise for weight loss is so important, which I forgot to mention, is that if people have unrealistic goal and they take on, and I've had patients come to me saying, you know, I've started exercising 3 weeks ago to lose weight and I haven't lost any weight, then they're going to give up on exercising. And so it's because I'm passionate about exercise for its health benefits that I don't want to give people unrealistic goal and to lie to them about the benefits of activity. I need to tell them that you're going to feel good and you're going to sleep better and you're going to have all these other benefits, and so that they evaluate the benefits of activity for themselves on that, but not about their weight on a scale. And I think physiotherapists can do that unemotionally and honestly, because they can tell patients what the benefits of exercise are. They're not invested, physiotherapists aren't invested in saying, yes, you know, exercise can make you lose weight. So that's why it's important. You know, people say, Karim, you're being negative about exercise. So I want people not to give up exercise because we're giving them the wrong goal. Now, answering this question that you were kind enough to ask me about the future of physio, I think, yeah, it's a bright future because the evidence has come in at an accelerating rate in the last 10 and 20 years for the power of physio in different dimensions. And physios have taken responsibility and done great research. I'm really impressed with the quality of physiotherapists' research and their evidence base for their profession. And so we can confidently say that physio reduces anterior knee pain. Physio is good if you've got back pain, and it's better than resting in bed. There's randomized trials showing that if you rupture your anterior cruciate ligament, only maybe half to 60% of people need a knee reconstruction, and say 40 to 50% can survive well without it by doing great proprioception programs. And this has all been shown. So I think, one, it's a great profession for young folks getting into. I think, obviously, with the aging, and you know, there's a need for folks with those skills. I think you can be very confident as a clinician and as an existing physio going, my profession is evidence-based. I don't need to apologise. You know, I can be very comfortable about the quality of evidence underpinning my profession. And then on a day-to-day practice, there's immediate reward because you see a patient get better, they come in, you do some treatments, you do a test, you know, before and after, and you can see that they've got better range of motion or less pain and those settings. So, yeah, you know, it's very exciting. My friends who are physios are very happy with their jobs and what they've contributed to society, and rightly so. And then I guess this prescribing exercise for non-communicable diseases is a new dimension, another wave that's adding to the value of physiotherapy for society, Dale.
Yeah, it's an exciting time to be a physio, or certainly train as a physio. As you said, we've got a good evidence-based profession, and we're expanding and exploring new areas. But you know, the real buzz for me is getting patients better. Someone coming in unable to move their shoulder, and you know, 30 minutes later coming out full range of movement. You know, that's the real buzz. And as we get into more prescription of exercise and we start going out into the community, we're able to spread the messages and get people moving, literally. So if we were to sum up the importance of exercise to the undergraduate physiotherapy student, how could you put it all in a nutshell?
Yeah. I think if we go with the two elements, we go with the physical activity is the single most important thing you can do for health. And I think we can say that the power of physical activity, improves your health to the same extent that smoking, diabetes, and obesity together decrease your health. So you can put those three together. If you want to be more conservative, you can say that the importance of physical activity is as important as giving up smoker for a smoker. So I think those analogies would be helpful. But I think trying to get the person who we're talking to feel the excitement when they felt good, they slept well, they had joy, they enjoyed nature. So go with the emotional side rather than a graph. In personal conversation and persuasion, but having the data in our minds that we know that we're speaking the truth. And then the second part, not a big part of this podcast, but just this idea that when physiotherapists are prescribing exercise in musculoskeletal conditions, so rehabilitating a hamstring strain, getting someone moving after a back injury, tendinopathies, there's a very powerful evidence for the exercise turning movement into repair. And so that's this idea of mechanotherapy that people can Google, and that the physical stimulus to the cell encourages the cell to adapt. It's adaptation. And so there's a two-pronged benefit of exercise within physiotherapy practice, and each one is substantial. You can easily say each one is massive for health without being hyperbolic, without overstating things. The benefit of physio for public health is massive, and the benefit of exercise prescription rehab compared to rest, which is useless, is massive in the musculoskeletal system.
Yeah, I love that analogy that you need to move in order to get better via, the mechanotransduction, and the body was meant to heal by being on the go. That's how we used to live, rather than, bed rest. You're not going to get better on bed rest. You need to move. You need to move well, and you need to move often, and that's evidence-based, and that's what the message we need to be getting out there is. Karim, it's been absolutely fantastic speaking with you. I know you're a busy man, so thank you so much for spending the time doing the very first podcast for University of Salford and Progressions in Exercise Therapy. Karim, I hope to speak to you again sometime soon, or see you at a conference. Once again, my friend, thank you very much.
I'm very happy to work with you, Dale. My pleasure, and congratulations to the University of Salford for a great program.
Thanks, Karim, and we'll see you again soon. Cheers now.